What is an invasive biopsy for breast cancer diagnosis? Imagine trying to solve a mystery about what's happening inside your breast. A biopsy is like collecting clues to find out if there are cancer cells present. When we talk about an invasive biopsy for breast cancer, we're referring to procedures that go beyond just taking pictures. They involve actually entering the breast tissue to remove a small amount of tissue or cells for detailed examination. This step is crucial because imaging tests like mammograms or ultrasounds can suggest something might be wrong, but they can't confirm if it's cancer. Only a tissue sample can provide that definitive answer. Invasive biopsies are considered the most reliable way to diagnose breast cancer because they give doctors a real sample of the tissue. This allows pathologists to look at the cells under a microscope and determine if they are cancerous. They can also identify the specific type of breast cancer, how aggressive it might be, and other features that help decide the best treatment plan. There are different types of invasive biopsies. The least invasive is the fine needle aspiration, where a very thin needle is inserted into the lump to draw out fluid or a small number of cells. This method is quick and usually causes minimal discomfort, but sometimes it doesn't provide enough information to make a final diagnosis. The more common approach is the core needle biopsy, which uses a larger needle to remove small cylinders of tissue. This provides a bigger sample, making it easier to identify cancer and understand its characteristics. Often, imaging techniques like ultrasound or mammography guide this process to ensure the right spot is sampled, especially if the abnormality can't be felt by hand. Another variation is the vacuum-assisted biopsy, which uses a special device to collect multiple tissue samples through a single insertion. This method is especially useful for tiny abnormalities or microcalcifications seen on imaging. When the abnormal area is difficult to reach or when previous needle biopsies are inconclusive, a surgical or open biopsy might be performed. This involves making an incision in the breast to remove part or all of the suspicious tissue. Surgical biopsies can be either incisional, removing part of the lump, or excisional, removing the entire lump. These procedures are more involved but provide the most comprehensive tissue sample. Most invasive biopsies are done under local anesthesia, meaning the area is numbed but the patient stays awake. For surgical biopsies, general anesthesia might be used. Imaging guidance ensures the correct area is sampled, especially for small or hard-to-feel abnormalities. Before the procedure, patients are often advised to avoid certain medications and refrain from using deodorant or lotions on the day of the biopsy. Afterward, pressure is applied to the site to prevent bleeding, and a dressing is placed. Patients can usually go home the same day, even after surgical procedures. The importance of invasive biopsies lies in their ability to provide a definitive diagnosis. While imaging can suggest the presence of abnormal tissue, only a biopsy can confirm if cancer is there. The tissue sample is examined by a pathologist who looks for cancer cells and tests for hormone receptor status and other markers. These details are essential for staging the cancer and planning treatment options. Of course, like any medical procedure, invasive biopsies carry some risks. These include bleeding, infection, bruising, or discomfort at the biopsy site. There's also a small chance that the abnormal area might be missed, especially if it is very small. However, the benefits of obtaining an accurate diagnosis usually outweigh these risks. The choice of biopsy type depends on the size and location of the abnormality, the patient's overall health, and the healthcare provider's judgment. After the tissue is collected, it is sent to a laboratory where a pathologist examines it under a microscope. Additional tests may be performed to determine hormone receptor status and other important markers. If cancer is confirmed, further tests may be needed to understand how advanced the disease is and to plan the next steps. Remember, each person's situation is unique. The decision about which biopsy method to use and what comes next should always be made in close consultation with your healthcare team. They can help explain the options, risks, and benefits based on your specific case. In summary, An invasive biopsy for breast cancer diagnosis is a vital step that involves removing tissue from the breast to confirm whether cancer is present. It provides the detailed information needed to guide treatment and helps ensure you receive the most appropriate care. Always seek personalized advice from your healthcare professionals to make informed decisions about your health.